It is Colorectal Cancer Awareness Month, and we're talking today with Dr. Shannon Wesley of Lima Memorial Hospital about getting those important preventative pre-screenings done. And first of all, thanks for being with us today, Doctor. And Dr. Wesley, can you tell us basically what colorectal cancer is and who might most be at risk for this type of cancer?
So colorectal cancer is any cancer of the colon or rectum. So if you can see the screen or the poster behind me, that's going to be what I call the funky looking question mark there on the outside. So that's the colon. The last part of the colon is called the rectum. All segments of the colon have a name. So rectal cancer is actually part of the colon. It's the same type of cancer. So we're looking for anything in the colon and then the segments of the colon, which are listed behind me. We really start the screenings younger than what the average age is for colon or rectal cancer because we're trying to catch it prior to these people general age, which would be, late 60s, early 70s.
What are some of the signs and symptoms that folks should be aware of when it comes to colorectal cancer?
So we talk about this a lot, and early stages of colon cancer don't have signs or symptoms, so it's very important that if you reach the screening age that you are doing the preventative things and being tested, because early stages of colon cancer don't have symptoms. And I think a lot of people misunderstand that because they think that they're feeling well, they're not having general GI, lower GI symptoms, so they don't think that they have cancer. But the earlier stages of cancer, again, I will reiterate, don't have symptoms. The people that are having symptoms, that are having changes, and those changes that we typically talk about are a change in bowel habits. And that's going to be something that's not day-to-day or something that's not typical for you, but something that's long-lasting, meaning a week, 2 weeks, or getting into a month or 3 months, and you're just not regular anymore. You can't go to the bathroom. You're only having bowel movements once a week. So change in bowel habits is a big one. Belly pain or abdominal pain. So we're looking from, here down into your pelvis, pain that's pretty regular and consistent. And one I always talk about is rectal bleeding. Bleeding from your bottom is never normal. I don't care if it's a little bit or it's a lot. If it's happened once or it happens every day, it's not normal. There shouldn't be blood from your bottom. We can say it's hemorrhoids all day long, but until we know that it's hemorrhoids, I can't tell you that it's your hemorrhoids. So the big things: belly pain, change in bowel habits, rectal bleeding. Now there are some other symptoms with advanced stages: fatigue, weight loss, decrease in appetite. Those are other things, but again, those are advanced stages.
Doctor, if someone is experiencing some type of symptom or they would like to just get a screening done, how would they go about doing that?
All you have to do is call my office. I usually have a consultation with the patients first, so we know, that you're of age or that you are having symptoms that warrant a preventative test or a diagnostic test.
Thank you so much for your time today, Doctor, and we thank you again for sharing all this information with us. And we'll be back with more right after this.